images are haunting. More than 25 million people have died since AIDS simmered into a pandemic in the 1980s. Those in developing countries remain hardest hit. 90% of infected people live in low and middle income nations.
I am so scared of dying of this disease. Who will care for my children when I am gone?
There have been real successes. The cost of anti-retroviral treatment has dropped drastically in the past decade. In places where it's needed most, there's more access to needed drugs.
If you look at the rate of people going on therapy, it was started off with just tens of thousands. Just a couple of years ago, we're now up to 4 million people who are receiving therapy in the developing world.
As head of the National Institute of Allergy and Infectious Diseases, Dr. Anthony Fauci is a top voice on AIDS. He says despite successes in battling the disease, doctors and scientists remain hard at work at what they call game changers that could vastly reduce the number of HIV/AIDS cases worldwide. At the top of the list, an AIDS vaccine.
Any really comprehensive prevention program will require a safe and effective vaccine.
In 2009, the largest vaccine trial ever involved 16,000 volunteers in Thailand. Tanat Yomha was one of them.
I did this for others, for the next generation.
Researchers say the vaccine cut the risk of HIV infection by a small but significant margin, providing a glimmer of hope.
It provided a clue that we could build upon to make better vaccines to the point where we may have a significant impact on preventing infections.
Scientists are also working on microbicides, creams or gels, which when applied could block the transmission of HIV. These could help women better protect themselves from infected partners. Condoms provide protection, but are sometimes unpopular.
In Africa, and Cameroon in particular, the use of condoms is not traditional.
One of the things that we are particularly encouraging about microbicides is that these are products which could be used by the woman, they can be inserted and used before sex, and they don't necessarily require the cooperation of her male partner.
Doctors are also testing so-called prophylactics, medications to prevent infection. The approach has been used successfully with malaria.
If you take people who are in risk groups and practicing risk behavior, can you dramatically cut down on their infection rate by actually preemptively giving them treatment before they get infected? That's a bold concept.
Daunting challenges still lie ahead in the fight against AIDS. In a global recession where countries' GDPs continue to fall, funding is an issue. Robert Heck is an expert on the finances of AIDS treatment.
We need to concentrate on expanded, smarter, and more focused prevention.
Heck says all countries affected by the AIDS crisis should work the cost of AIDS care into their national insurance plans. It's a chronic disease, he says, we are sure to deal with in the decades to come. Laurel, Bowman, VOA News, Washington.